How is ADHD diagnosed? Well, first of all, it's a clinical diagnosis. That means we take a look at how the child is behaving at school, home, and extracurricular activities. We look for the core features, attention distractibility, and hyperactivity and impulsivity. The Diagnostic and Statistical Manual has broken ADHD down into two types. The predominantly inattentive subtype, known by many people as just ADD. There's 9 criteria. You have to have 6 of these to meet the diagnostic criteria for inattentive subtype ADHD, talking about things like being forgetful, easily distracted, losing things, being disorganized, really the core symptoms of inattention and distractibility. A second subtype of ADHD, one that most families know as just ADHD, having the hyperactivity component to it, is hyperactive and impulsive subtype. This will often be described by families as a child who is constantly on the go, as if driven by a motor. Something I hear is children being dangerously daring, blurting out answers, having impulsivity. And impulsivity is where if you discuss right and wrong with the child in a very calm environment, and they may say something like, well, sure, I would never hit someone in class, or sure, I'd never swear in this situation. But in the heat of the moment, they do things out of character, and that's a hallmark of impulsivity. I'll often ask families about a family history, looking for some sort of genetic tendency towards their symptoms. We know that ADHD tends to run in families. Go even as far back as a birth history. We know things like intrauterine exposures or perinatal problems can cause ADHD symptoms. And then get a careful school history. I even like to have questionnaires completed by teachers, even feedback from a school psychologist in making a diagnosis. Now, often to supplement the Diagnostic and Statistical Manual diagnostic criteria, I'll make what's called a questionnaire-based diagnosis. I really like this because it gives me a lot of information from different sources. This is where you take a validated and reliable questionnaire, such as a Conners rating scale or a Vanderbilt assessment. You have it completed by parents, a teacher, other people who know the child well, the sports coach or tutor. And it takes the core diagnostic criteria out of the DSM and puts it into everyday sort of terms that are able to be rated on a scale of 0 to 3. And we're able to score the child in a more objective way. These questionnaires also look for ADHD mimicking conditions, screening for things like oppositional defiant disorder, conduct disorder, and anxiety and depression. You might call that a questionnaire-based diagnosis. It helps give an overall picture of how the child's doing, especially in different areas such as school and extracurricular activities. There's some computerized testing that can be done, such as a TOVA test. This is a test where a child will sit in front of a computer and push button in response to something that shows up on the screen. The evidence for this, is, as far as the validity of the test, is mixed. Some children may be more interested in computer-based activities where some may find it less interesting. There's some variance there. Overall, it's a nice diagnostic tool to help complement an ADHD diagnosis. Psychoeducational testing is important, especially for ruling out some ADHD mimickers, and there's some other Conners continuous performance tests and other things that can be done in the setting of psychoeducational testing to help make a diagnosis. And then something called examiner's best estimate. That's where I'm sitting with a family and a child in the office, taking a careful history, thinking in my mind of Diagnostic and Statistical Manual diagnostic criteria, and coming up with a diagnosis just based on the fact that I see thousands of children in my office over the years, and no typical behavior versus a child with ADHD. Often what I'll do in that setting is suspect a diagnosis, talk to the family about it, maybe suggest some lifestyle changes, behavior modification strategies, but wait for more aggressive treatments such as starting medication till I get a little more feedback from teachers and possibly an educational psychologist. In this section, I just want to add a bit about talking about the utility of some other scans and tests that can be done. For now, there's not good evidence in the medical literature that any sort of scan or mapping is useful for making a diagnosis of ADHD. For now, it's just a clinical diagnosis, looking at the core symptoms children have with ADHD. In the future, we know that there's some things that we've seen, for example, changes in the caudate or the corpus callosum, different parts of the brain. We may have better studies in the future that help us make more of a radiographic diagnosis rather than just a clinical diagnosis. For now, clinical diagnosis using diagnostic and statistical manual criteria, often supplemented with things like questionnaires or a computerized test.